We begin tonight where we began last night. We brought you the story of Robert Erueti, a 53-year-old Auckland man who was evicted from his Housing New Zealand home after traces of methamphetamine were found inside it. The level of contamination was low, just 0.09 milligrams above the standard used at the time, more than 9 milligrams less than the standard used now. He was forced out in March of last year. He's been living a transient life ever since, either sleeping rough in motels or boarding accommodation, and most recently in a tent near his daughter's house. But he spent at least 58 weeks in a motel paid for by the taxpayer, making him New Zealand's longest emergency accommodation motel tenant because of 0.09 milligrams. This is what he told our reporter Michelle Cook.
I kind of felt that this was going to drag on. In my heart, I thought that they would never get her, or they would never help me. And I felt that they had forgotten about me.
Robert Erueti. Now, Housing Minister Phil Twyford said Robert should never have been put in that position in the first place, and he wouldn't have been evicted under his leadership. The Minister met Robert and his daughter Casey in Auckland today, and Phil Twyford joins us now. Are you there, Minister?
Yes, hello, John.
Hi, nice to talk to you. Welcome to Checkpoint. What did you discuss with Robert and Casey?
Well, I went and saw Robert and Casey today to meet them because I listened to Michelle Cook's story on Checkpoint last night, and I heard them tell the story of what's happened to Robert since he was evicted more than a year ago, and first living in a motel, then a grotty boarding house, and now living in a tent. And it really summed up for me what I felt for a while now about how wrong Housing New Zealand's policy had been handling this issue of meth contamination. And I felt that it was so bad and so wrong what had happened that Robert deserved an apology. So I went and met with Robert and his daughter Casey, and I apologised to them on behalf of the government and said that I thought it was wrong what's happened, that it should never have happened that way. The eviction of Robert from his Housing New Zealand home made his life immeasurably more difficult. And I wanted to tell them that Housing New Zealand's changing their policy, and they are moving to a new approach to dealing with these issues that I think is more compassionate and more considered. So if a tenant or someone in their family has an addiction problem, the first response won't be to kick them out. It will be to help them get support to deal with that addiction.
So are you announcing that now? Is this a brand new policy? Are you telling this for the first time tonight?
This is the first time that as Minister, I've spoken about this policy. But I want to acknowledge Andrew McKenzie, the Chief Executive of Housing New Zealand, who has been of the view for some time himself. He's been in the job about 14 months, and he hasn't been happy with the approach that was taken. He has really done the hard work on this, and I support him absolutely. I share his view that kicking people out of their home, often vulnerable people, kicking them out of their home in the middle of a housing crisis and making them homeless is not a constructive or sensible response to something like addiction.
And as we saw with Roberts, they were evicted with no proof whatsoever that the very small traces of methamphetamine that were found, and these were tiny, tiny traces, were there because of their behaviour.
That's exactly right. You put that on top of the fact, John, that even if he had been responsible, how is evicting someone in this situation any kind of sensible response? You know, we know that many of the people who are chronically homeless have addiction problems. So how is evicting someone who has, someone in their family or a friend who's visiting has a substance abuse or addiction problem? How is evicting them and making them homeless?
So are you saying that Housing New Zealand? Are you saying Housing New Zealand's had this wrong?
I am saying that. You know, over the last 3 years, Housing New Zealand, on behalf of the taxpayer, has spent $75 million on testing and remediating houses that are or were allegedly contaminated. Some 900 properties have been left vacant in the middle of a housing crisis on the basis of a methamphetamine contamination standard that cannot distinguish between a place that is genuinely contaminated for instance, by the manufacture of methamphetamine, and would therefore pose a risk to someone's health while living in that house, and an infinitesimally small residue that would pose no risk whatsoever.
Can
so
you
the
give us,
standard itself is a sham.
Can you give us that figure again?
So some 900 properties in the last 3 years have been left vacant.
What's been the cost of testing and remediation?
$75 million over 3 years.
And that's at a level of 0.5, which is extraordinarily low, isn't it?
That's correct.
Has there been,
go on, sorry.
No, has there been a moral panic here?
Yeah, I believe that the moral panic around methamphetamine contamination of houses is the context here. And I think that has been both drummed up and exploited by a meth testing industry that saw an opportunity to make a dollar by taking advantage of that moral panic. Put that together with the fact that we've had a standard that was patently not fit for purpose. And the result is that landlords, private landlords all up and down the country, and the country's biggest landlord, Housing New Zealand, have been put in an impossible situation. They have got the insurance companies breathing down their necks. They don't want to put the health of their tenants at risk. All they can reach for is a government-endorsed standard. The standard is patently not fit for purpose or wasn't. And so we've had this, I think, a ridiculous situation where this much money has been wasted, hundreds of people evicted unnecessarily, and hundreds of houses left vacant in the middle of a housing crisis.
Phil Twyford, who was the Housing Minister, joining us live with a fairly major development in the government and Housing New Zealand's response to the detection of very low levels of methamphetamine in Housing New Zealand homes.